Helen Maguire.
Thank you, Madam Deputy Speaker, and I thank the Honourable Member for North Shropshire for securing this debate. The backlog in the NHS is a national crisis, and it is acutely felt in my constituency of Epsom and Ewell. Patients, families and staff are bearing the brunt of an overstretched and under-resourced healthcare system. This morning, I was delighted to see the Prime Minister and the Health Secretary in my constituency, in Epsom Hospital, part of the Epsom and St Helier Trust, to announce this government's plans to tackle the backlog of tests, checks and treatments. I welcome many aspects of today's announcement. Direct access to checks, cut unnecessary waiting times, and if implemented well, will result in better patient outcomes as health issues are found earlier. The location of this announcement at a hospital connected to St Helier Hospital was particularly potent. Over the Christmas period, St Helier Hospital, which has been at the heart of healthcare in the community for generations, made the news again. Its sinking floors and leaky ceilings illustrate the failings of our NHS. The facility is failing. Some of the buildings are older than the NHS itself, and it is plagued by damp, mould and structural issues that impede patient care. The hard-working staff at St Helier Hospital are doing their best in impossible circumstances, but the reality is that the current infrastructure hampers their ability to provide the level of service and quality care my constituents deserve. Epsom Hospital too is struggling to cope with demand. Over the winter recess, I heard harrowing stories from constituents who face unacceptable A&E waiting times. One mother brought her child to Epsom Hospital for a suspected broken wrist and endured a 7-hour wait for an X-ray, finally leaving in the early hours of the morning. While there, she encountered another mother with a 9-month-old baby who had a bump on its head. They left after 6 hours without being seen because they could simply not wait any longer. One constituent's 86-year-old mother was told by the 111 service to go to A&E at Epsom Hospital after an injury, only to be informed that it would be a 10-hour wait, asking her to stay up until 2 a.m. after a potentially serious injury. These are not isolated incidents, but rather the lived reality for many families. These delays stem from a combination of rising demand, staff shortages and an ageing infrastructure that cannot keep pace. While I welcome elective care capacity will increase, hopefully reducing the waiting times for care for many patients, this must also come with a focus on improving emergency care. Ring-fencing elective beds while people wait for emergency care, dying in waiting rooms and corridors or leaving without being unchecked is nonsensical. We must increase the number of staffed hospital beds to end degrading corridor care. Further, there must be a qualified clinician in every waiting room to ensure any deteriorating conditions are picked up on. Locally, it's vitally important that Epsom and St Helier hospitals are at the front of the queue for necessary repairs, and that the new specialist emergency care hospital in Sutton is at the top of the priority list for this new hospital programme.
On that point,
I give way.
you give way. I thank my honourable friend for giving one that point. Epsom and St Helier Hospital Trust covers my constituency of Sutton and Cheam as well, and many of my residents rely on the hospitals at both Epsom and St Helier for their care. Does she agree with me that it is an absolute failure of the previous Conservative government to deliver one of the promised 40 new hospitals from 2019 that has led to the degradation in care for both of our residents across both our constituencies? In addition, does she agree with me that the government must come forward with that funding that both our constituencies need and our residents need to reassure them their healthcare needs will be met into the future?
Helen Maguire.
I thank the member for the intervention. I absolutely agree. This is partly a failure of the previous Conservative government that the hospitals have not been built, and it is absolutely vitally important that Epsom and St Helier hospitals are put at the top of the list as priority for new hospitals. The new hospital will improve outcomes by consolidating critical services under one roof, easing the strain on staff currently stretched across 2 sites. Moreover, it will enable Epsom and St Helier hospitals to focus on elective care, diagnostics and outpatient services, helping tackle the backlog more efficiently. Crucially, the new hospital will expand the overall number of beds by centralising major acute services. Estate challenges will be addressed, staffing levels will be strengthened and patient outcomes will improve, reducing the intolerable waiting times currently experienced at Epsom and St Helier hospitals. I turn to the distressing delays for ADHD assessments. The September 2024 DARSA report highlighted a stark reality. Demand for ADHD assessments has grown so significantly that it risks overwhelming available resources. Nationally, it could take an average of 8 years to clear the backlog at the current rates. One of my constituents, Sophie, has been facing the brunt of this backlog. She's been waiting since June 2020 for an adult ADHD assessment, and she will be waiting quite a bit longer, as Surrey and Borders Partnership NHS Foundation Trust has informed me that they're currently addressing referrals from as far back as March 2019. And the root cause is a mismatch between demand and funding. The service was commissioned to support 400 assessments annually, but now receives 400 referrals every 2 months. Sophie, like many others, has been advised to seek private assessment, an option financially out of reach for her, as she's been unemployed due to her symptoms. It's an inefficient system that should be reconsidered to help reduce the enormous backlog, and this situation is wholly unacceptable. I will give way.
Currently, a third of children with a serious eating disorder are not seen within the NHS waiting time standard. Does the Honourable Member agree with me? Such delays only make matters worse, leading to sicker children, more suffering and greater costs to the NHS.
Maguire.
I thank the member for giving way, and I absolutely agree. Prevention is key here. If we don't deal with issues immediately, then it would just takes longer and it's more costly in the long term. But to conclude, the people of Epsom and Ewell, they simply deserve better. They deserve a healthcare system that works for them, not against them. And I urge the government to act swiftly to address these issues and to deliver the investment and reforms our NHS so desperately needs.